Welcome to today's episode. Hello, everybody. We will be discussing the powerful intersection of integrative medicine, functional medicine, and the mind, body, spirit approach to healing. I am so honored to introduce our next guest, Dr. Kelly McCann. Dr. McCann is a compassionate physician who has guided thousands of patients on their healing journeys from chronic illness, hormone and thyroid imbalances, autoimmune disease, and complex environmental health conditions. Dr. McCann earned her medical degree and master's in public health at Tulane University, completed dual residencies in internal medicine and pediatrics, and is one of only 35 physicians worldwide to complete the prestigious Integrative Medicine Fellowship with Dr. Andrew Weil at the University of Arizona. She's also certified in functional medicine and integrative medicine, bringing a deeply holistic and personalized approach to every patient she serves. In addition to her medical expertise, Dr. McCann holds a master's in spiritual psychology, which beautifully enriches her work in connecting the mind, body, and spirit. She serves on the boards of the American Academy of Environmental Medicine and the International Society of Environmentally Acquired Illness and lectures internationally on topics like mold and mycotoxin illnesses, Lyme disease, and mast cell activation. Outside of her clinical practice in Orange County, she's passionate about yoga, hiking, traveling, and continuing to learn and grow. I am so excited for our conversation today, Dr. McCann, and I just wanted to kind of revisit how long we've known each other. So just to give a little bit of history, we were we were neighbors, gosh, for quite some time actually, in the same
Yeah.
medical building. I think that's how we first met. And
Yes.
yeah, it was definitely over a decade ago. And
I moved in 2010.
oh goodness, that's really dating me now, but yes,
I know,
it's
I
definitely
know,
been
I
over
know.
a
When we
decade.
were teenagers, I moved
That's
in as a
right,
teenager.
exactly. Yes, and especially with all of your qualifications, I think you must have started your studies at like age 5. But since then, I just am so honored to continue to co-treat patients with you, and we are so grateful for all of your referrals for Chinese medicine and acupuncture. And I've just seen the amazing work that you've done with your patients, and I think when the patients are really frustrated with the chronic conditions that they have and they can't find the answers and they've gone, down sort of the more traditional Western medical model and they're still not feeling optimal, or still just feeling really not like themselves, it's a great option to turn to a practitioner like yourself who really does an amazing job at integrating Western medicine, functional medicine, and the mind, body, spirit. So I'd love to hear a little bit about how you started in medicine and what drew you to medical school and then your further studies that you continued. Well, it sounds like you continue to grow.
I continues to go. Yeah. I can't stop. Thank you. Thank you so much for having me, Tina. I'm really happy to be here. And it is amazing to me that we have known each other for 15 years. That's
Yes, for
crazy. That's
sure, for
crazy.
sure.
And I love being able to refer patients to you because it's so helpful to have that Chinese medicine perspective. And, that's really what integrative medicine is all about. It's recognizing what each practitioner brings to the table and what's my forte and what's your forte and how we
Mhm.
can synergistically work together for patients on their healing journeys because it takes a village, just like it takes a village to raise a child. It takes a village
Definitely.
to help people really get back on track.
Hmm.
Um, so thank you for that. In terms of my start, I was a music major in college. I had no intention of becoming a medical doctor. And then after that, I realized, okay, no, I don't want to be an opera singer for my life. That's not, that's not
Wow, was that your background?
Yes, yeah, that's what I thought. I went to Brown undergrad and would take the bus every week up to Boston and study with a woman at New England Conservatory. And at one point, she said to me, "Kelly, you have a beautiful instrument, but you don't want this badly enough." And I
Hmm.
was like, you're right. I don't. I
That
don't.
must have been really hard to hear.
But it was true. She didn't
Hmm.
tell me anything that I didn't already know because
Sure.
I didn't have the heart for it. I just didn't really want to like spend 4 to 6 hours a day practicing. Now
Hmm.
I spend 4 to 6 hours a day or more, like reading medical literature.
Sure.
But yeah, it was eye-opening and really made me switch gears. So at that point, I didn't know what I wanted to do. I had this very useless bachelor's of arts in music. And my mom, who's a librarian, said, well, why don't you come home, go to library school, and you can kind of figure it out. At least then you'll have a skill. I said,
Hmm.
okay. So I went home to upstate New York and I started getting my master's in library school. And I realized, well, the things that I like about this is the mind and the brain and how it organizes information. And, maybe I'll go do neuroscience. Well, that would have been 3 more years of undergrad in order to go to
Hmm.
grad school in
Sure.
neuroscience. And I only needed 1 year of biology, chemistry, and physics to go to medical school. So I thought, okay, well, I'll go to medical school and I'll study the mind and the brain, and that'll be fun. And I did some public health classes then, and I was taking a meditation class with an acupuncturist, and I just was in awe. I thought acupuncture is really what I want to do.
I love that.
And my parents convinced me to go to medical school. And I said to myself, okay, if I get in, I'll go. But if I don't get in, I'm going to acupuncture school.
Hmm.
Darn it, I got in. So off to medical school I went. And then I was a bargain shopper. My grandmother, who lived with us when we were little, um, she grew up in the Depression, and so she was like the ultimate bargain shopper. She'd be shopping for clothes for Christmas gifts in like February. So
Nice.
I
So
got
prepared.
so prepared.
Yes.
So I was offered the opportunity to get a master's in public health while I was at medical school, so I did that. And then rather than just going and picking one residency program, I picked a dual residency program because I couldn't pick just one. So I did internal medicine and pediatrics. Um, and, definitely struggled through because Western medicine is very particular about the way that things are done, and they don't really
Mm.
care about emotions or um, the the psychology even of things. Certainly no spirituality gets talked about
Mhm.
in Western medicine. And yeah, then I graduated and knew that I wanted to do integrative medicine because that was really the thing that was most holistic. So I got into the fellowship with Dr. Weil, and then, it just kind of snowballed from there. Once you do integrative medicine, you have to do functional medicine because you have to know all the tests and how to really like navigate the biochemistry and the genetics. Um, and as I was opening my practice in 2008 to 2010, I got a master's in spiritual psychology. I was encouraged by a current boyfriend at the time to go get this
Mhm.
degree. And it really changed the way that I saw illness and disease and opportunity for patients. But it wasn't something that I would bring up with everyone. It really kind of
Yeah,
depended on the person.
absolutely. I get that.
Yeah.
Mhm.
But it's become more and more what I feel really passionate about because what I see, the people who get better, and I see very complex chronic illness these days, but the people who get better are the ones who are open to the conversation, that there is more to their healing journey than just dealing with the nervous system or dealing
Mhm.
with the immune system or dealing with the endocrine system, that they really have to start to look at what are the thoughts, what are the beliefs, how are they talking to themselves, and how does that color how everything else functions. And so I can share some stories of some patients who have really had life transforming. Um,
Yes, please. We would love that.
um, so I had one woman. She probably had been sick with POTS, which is postural orthostatic tachycardic syndrome, where the heart rate shoots up when she stands up. And it's in the family of conditions called dysautonomia. So the autonomic nervous system is not adjusting to changes in positioning. So you go from lying to sitting to standing. The body is supposed to be able to accommodate that. So, we get an increase in our blood vessel pressure so that we can stand up. And when that doesn't happen, the body has to accommodate. And so when we stand up, um, and our autonomic nervous system doesn't do its job, then the heart rate kicks in, excuse me, and it shoots up because it's trying to perfuse the brain, right? We don't function very well if we don't have any brain flow, our blood flow into our brains.
Mm-hmm.
Um, so this patient, she couldn't stand up for more than a couple of minutes without feeling dizzy and lightheaded, and her heart rate would jump into the 140s, 130s, 140s. And so she had little chairs or stools or different things to sit on all throughout the house. There were some days that she had to not drink or eat anything because she couldn't get to the bathroom without assistance,
Mm.
or she would have to crawl to the bathroom because she couldn't stand up, because she would get so dizzy and so lightheaded. And she was extremely reactive to all sorts of things. And, it was a mystery for her for so long. And then eventually, somebody pointed her in the direction of maybe, you should go to the Mayo Clinic. And so she went into the Mayo Clinic, and this was a couple years before she saw me. And she was actually given the diagnosis of POTS. And they said, you probably have mast cell activation also.
Mm-hmm.
But they didn't give her anything.
Hmm.
And then she went to see a couple of other very reputable, very like world famous functional medicine doctors, and they still didn't treat her. And then she had a couple of weird labs that nobody bothered to tell her about. So she gets to my office, and it took her 2 weeks just to fill out my paperwork because it was so exhausting. And then after that, it took her 2 more weeks to recover.
Mm.
So this is a woman who's very, very committed to trying to figure this out, right?
Sure.
And about a half an hour into our hour-long appointment, she has to lie down on my couch because I can see she's starting to turn a little gray and her eyes are getting glassy.
Mm-hmm.
Um, so this is where we started, right? And I put her on actually a medication for POTS, changed her life. Like, this poor woman was suffering, and all she needed was a little bit of medication to help her heart rate be more stabilized. And then we started working on her mast cell activation. We started identifying that she had mold and she had hyperparathyroidism and she had some Lyme disease. And so we started detoxing and treating, and she's slowly starting to get better. And about a year and a half in, her husband tells her, like, he's having a conversation about the weather. He says, um, I'm done. I want a divorce.
Oh
She's
my
like,
goodness.
what? They had been together since college, and
Wow.
he was her rock this entire
Mm-hmm.
time.
Hmm.
And now she's finally getting better. And he's like, I'm done. And she came in and she's crying about this. And she said, he's the only, he's the only person who's been there this entire time. I can't believe that this is happening. And I said, you know, he's not the only person. You are the constant. You are the one who's always been here for you. And it was like a huge light bulb went off for her, because not only was she really there for herself, um, but she just realized in that moment, like, yes, and my body is working to get me better. And
Right.
and she really had a reframe of, this idea, because we have this idea that the body is against us when we start to not feel well.
Mhm.
And we think it's torturing us, or like
Mhm.
we don't understand why it's not going in along with our plans for ourselves,
Sure.
right? But she really started to see that her body was on her side.
Hmm.
And I think that made a huge difference for her. And I saw her a couple weeks ago. So she's working full time. She's divorced. She was able to move out of her home with her ex-husband into a new apartment, and she was able to do all of that. And for anyone who's ever moved, you know how hard that is,
Yes.
packing
Yeah.
everything up and moving it. And
Right.
yeah, she had help, but she was able to do all of that, like, 13, 14, 15-hour days, several days in a row. She uh, walks on the treadmill. She's starting to lose weight. She's lost 40 pounds. I mean, she
Wow.
looks amazing. And she has a, a I'd say a new lease on life. That's
Hmm.
probably not accurate, but yeah, she's got this beautiful life now. And she knows that things are just going to continue to get better.
Well,
And
that's such an incredible story, Dr. McCann. And I love how you were able to kind of guide her to like really tap into that inner knowing and inner trust that she can rely on herself. Like that's such a huge missing link for a lot of patients, because they're so used to looking externally and outside of themselves
mhm,
for support and guidance, but really there's so much within yourself that, you can lean on and trust. And, we say in Chinese medicine that we all have this innate self-healing mechanism within ourselves that unfortunately sometimes it gets thrown off kilter, right, for whatever reason, because of stress or lifestyle, or just sometimes we have really tough emotional challenges in our lives that throw our body for a loop. So it takes a minute to kind of reactivate that self-healing mechanism within and that ability to kind of heal and support yourself. So what a beautiful story. Thank you for sharing that. I'm sure you have so many other cases like that. And, I'm just curious to know, how is it that the other doctors weren't willing to treat her? Like it seems like they just kind of, left her with no treatment options.
I, this is what really baffles me. I mean, the whole gaslighting concept too, that, um, yeah, I really, I can't say that I understand it because that's not my perspective at all.
Mm,
When, I think that practitioners should look at the situation and say, okay, there, there's somebody who's suffering in front of me, and I want to do two major things. I want to help the symptoms, right? Help
mhm.
calm the symptoms down, whatever's going on. And then I got to get to the root cause,
Sure.
right? And if I don't do those two things, they're never getting better. But yeah, I mean, this poor woman, it confounds me. I don't think that, you know, her journey probably started 15 years ago. So I don't think that people knew what mast cell activation was or what POTS was. It's
Mm-hmm.
very common now, that people understand what it is. But I think at the time, um, a lot less people knew what it was.
Well, this brings up a very interesting question. Can you tell us a little bit about mast cell activation?
Sure.
Since it's kind of, I don't want to say a newer diagnosis, but one that is not diagnosed commonly, maybe because, it's not thought of firsthand by practitioners.
Yes. So it was first described in the medical literature in 2007. So
Okay,
it
pretty
is a
recent.
relatively new diagnosis. Um, However, being an environmental medicine physician, people were talking about multiple chemical sensitivities in the 50s and 60s.
Hmm.
And multiple chemical sensitivity is a form of mast cell activation syndrome.
Okay,
We just didn't know the path, what we would call pathophysiology, right? We
sure.
didn't know what was causing the multiple chemical sensitivity. Now I think we have a much better understanding as to what's happening. So mast cells are MAST. Mast cells are normal cells in our immune system. They are actually related to our red blood cells and our white blood cells. And they're born in the bone marrow, like
Mhm.
our white and red blood cells. And then they move to the areas between us and the outside world. So they like line the respiratory tract and our
Mhm.
upper respiratory tract, our GI tract, bladder, mucous membranes. They're on the skin. They line the blood-brain barrier. They hang out around the nerves and the blood vessels. And their job is to identify foreign invaders, what they perceive foreign invaders to be. And when they do, they're filled with all these beautiful inflammatory mediators we call cytokines and chemokines, and things like histamine and serotonin, heparin, prostaglandins. And when they perceive a threat, they sound the alarm by dumping all of their mediators into the local environment, and that tells the rest of the immune system, "Hey, we have a problem here. Come here and help out."
Mhm.
Um, and so this was the cytokine storm, right? When people were very, very sick with COVID, the mast cells were going crazy, dumping all these inflammatory mediators. And we now understand that chronic illness, a lot of chronic disease is a result of chronic inflammatory responses, right? So the mast cells are playing a role there too. With mast cell activation syndrome in particular, the mast cells have gone a little rogue and they've started seeing danger everywhere.
Mhm.
And so, I mean, the interesting thing is that the mast cells in your upper respiratory tract, like in your sinuses and your nose, are different from the ones in your gut. And they're different from the ones that hang out around your blood vessels. And they're also different in the receptors and in the mediators themselves, and they're different from person to person.
Mhm.
Oh my goodness, right? This
Wow.
totally
Yeah.
makes things really complicated.
Yes.
So mast cell activation syndrome is a clinical diagnosis where you have inflammation, allergic symptoms, or even growth symptoms like growing lipomas or
Mhm.
cysts or things like that, because there's growth hormones also in mast cells. And it has to affect multiple systems and multiple symptoms. So the longer the list of symptoms that people have that are inflammatory and allergic in particular, the more suspicious I am. Most people don't have a lot of the growth things, but that can happen
Mhm.
in some of my mast cell patients. So usually they have a long laundry list of symptoms. And then oftentimes, historically, like they were allergic kids, they had asthma, they had
Mhm.
eczema, they had allergies. And then it might have morphed a little bit, like those allergies went away and they show up as other things. And you see this stair step in symptoms of each time they get exposed to something that the body perceives as foreign, they will have an increase in their symptoms. And I will also say, oftentimes there's some sort of trauma
Mhm.
or adverse childhood event or events that's happened in their history, whether they realize it or not, that have primed their immune systems to perceive foreign invaders and
Mhm.
threats.
That makes sense.
Yeah.
So do you oftentimes see a combination of multiple, like, autoimmune conditions with mast cell activation?
Yes. Many of my colleagues in mast cell, actually one colleague in particular, Andrew Maxwell, who's a pediatric cardiologist, came up with this concept of the pentad patient. And so it's mast cell activation, autoimmune conditions,
Mhm.
and dysautonomias, like we talked about with the POTS, as well as connective tissue disorders like
Mm.
hypermobility,
Mhm.
EDS,
Mhm.
and then sometimes some gastroparesis.
Okay.
And from there, there's more constellations of symptoms around that. So we'll often also see things like interstitial cystitis and endometriosis,
Mhm.
different autoimmune conditions. I see a lot of SIBO. And I think these things, so there's genetic susceptibilities with the EDS, and then there there are environmental susceptibilities, And then there's that sort of predisposition of um, nervous system and immune system dysregulation.
Sure. And I know it's different for every patient, but what are some of the common treatment options available for these patients?
Yes. So remember, I talked about treating the symptoms and
Sure.
then treating the root cause. So in
Hmm.
terms of treating symptoms, we can use a lot of different things. I mean, the good news about mast cell activation, there's lots of things that we can do to like calm those mast cells down. There's over-the-counter antihistamines like the H1 blockers, Benadryl, Zyrtec, Claritin, Xyzal, Allegra, Pepcid, that's your H2 blocker. And then there are prescription medications that can be helpful, cromolyn, ketotifen, um, leukotriene inhibitors. And then there are a ton of supplements.
Hmm.
Um, for 70 different kinds of supplements, and then all the combinations of things. So quercetin, luteolin, um, paramine, pycnogenol, DAO enzymes that help break down
Hmm.
histamine, certain kinds
Yes.
of probiotics that are low histamine probiotics. Let's see, resveratrol, PEA. I mean, I could just go on and on
Oh,
and
yes.
on.
Yeah. It's
Right.
amazing that there's so many natural options too.
Yes.
And do you find that one works better than the other, or do you typically combine the two together?
We're often combining them.
Hmm.
And what I find is that each person's regimen is different.
Hmm.
Some of my conventional colleagues are very, so Lawrence Afrin, who was one of the first um, medical doctors to write about mast cell activation, who's taught most of the practitioners in the United States and abroad about mast cell activation. He's very regimented and he'll have patients try every single one of the H1 blockers to find which one works best for them. And, we have like 4 or 5 in the United States. H Actually, we have more than that. I'm sorry, there's a bunch of prescription ones. And then there's a whole bunch that you can't get in the United States, and he'll often like, and I will too, give people prescriptions for Canadian pharmacies to try some of these other
Hmm.
H1 blockers if I think that they're going to be beneficial.
Sure.
Um, and and that's one way to do it. I actually use my intuition, and if the
I
patient
love
is
that, Dr. McCann. Love that about you.
Thank you. You know,
And that's the secret sauce right there, right? Is not like one size fits all. You can't
yeah,
just do this, same protocol each time for every person because everyone is so unique,
exactly.
and they're just unique, beautiful beings, and everyone just needs like their special care, customized plans, and of course, my background, so I lean very heavily on the interest of women's health and
Right.
fertility. So, how does this mast cell activation and autoimmune conditions impact fertility? How does it impact women as they're going through perimenopause and menopause? I'm sure there are some complicating factors there.
Yes, there definitely are. Um, because it can be complicating from multiple different standpoints. So every cell, particularly the mast cells, we'll talk about mast cells. So they have receptors on the cells themselves that are stimulating them to release their mediators, right?
Mhm.
So you can have cortisol receptors on the mast cells. You can have hormone receptors on the mast cells. There are thyroid receptors on the mast cells. So you get the picture. If the
Sure.
endocrine system is off, if you're super stressed, most of my mast cell patients are like, gosh, stress makes everything worse.
I wonder why.
I wonder why.
Yes.
Right.
Yeah.
Well, technically, because there's cortisol receptors on your mast cells, and you're
Hmm.
stimulating your mast cells to
Hmm.
degranulate. So yeah, there is a ton of overlap depending upon, your mast cells and how dysregulated your nervous system is. And I also find with a lot of my mold patients, and I don't know about you, Tina, but Mold is everywhere in Orange County and
Mm,
in Southern California in general. I think we just don't build very well. One, and I think, I don't know, this is my theory. I think that there were probably lots of pesticides and fungicides that were used on the agriculture that was here, and now they're in soil, and they have self-selected for really, really bad molds.
mhm.
And then we build, and then those molds get into the buildings because they're just there in the soil.
Sure.
Um, the slabs are wet all the time because we water on a regular basis because it
Hmm.
doesn't rain here. And then if any of the building materials, the wood, the sheetrock is touching the slab, it's wet, and
Hmm.
that just wicks up, and there you've got a source of mold and moisture and wood and paper for mold to eat and grow on. That's a recipe for disaster.
Yeah.
And the molds dysregulate so many things. They trigger mast cell activation. They trigger autoimmune conditions.
Mm.
They're carcinogenic in some instances, and they dysregulate hormones. I had one woman in her um, mid 30s came in. She wasn't menstruating at all. She had just had a
Oh.
baby like
Mhm.
4 or 5 years ago, and she
Mhm.
just wasn't menstruating. And she was crazy. I mean, this was not just perimenopause. She felt insane because she didn't have any hormones.
Mhm.
And we actually put her on the Wiley protocol to give her,
Yeah,
cycling hormone replacement. And that just was a huge game changer for her. She's another one of my amazing patients who now is studying to be a medical intuitive. And she just is like such a light in the world.
that is so
And
cool. I love
yeah,
that.
just so, so, so cool.
Yes,
But yeah, started out really in a bad place.
sure.
So yes, hormone dysregulation and mast cell activation through these changes is very, very challenging. Um, and then to like bring it back into the conversation about the spiritual piece too, I think, how we are with our bodies, how we are with our sense of well-being as women. Like if we see old is bad, you know, it may
Mhm.
really be a bumpy road through menopause.
Mhm.
But if we're able to like come to some sort of peace with the transition, it might not be quite as awful as it is for some other people.
Hmm. I think we live in an area, Dr. McCann, where I think we're kind of trying to run against time a lot, and there's so many like societal pressures too to kind of stay youthful and look a certain way. But I think what you said was so empowering. Like we gotta just like accept the graceful aging process and know that, in Chinese medicine, we call it the second spring,
Mm.
right? It's our second spring or our second awakening. And it allows us to really reflect on life. We're wiser, we're brighter.
Mhm.
We usually have more resources, right?
All of the
So,
things,
yeah.
yes, all of
So
that.
we got to embrace that and take advantage of the opportunity, I think, to grow even more spiritually, mentally, physically, all of it, and not fight it so much. So,
Right.
yeah. So, as far as for your patients that are kind of in this transition, it sounds like bioidentical hormones can be a good option along with some of the other treatment protocols for mast cell activation, chronic inflammation, things like that. So, is that something that you um, tend to practice or advocate for women in this stage of life?
Absolutely. It all boils down to personal preference, right? I'm not going to tell somebody she has to take hormone replacement, but
Sure.
there are certainly many positive benefits, including brain health benefits.
Hmm.
There's a lot of estrogen receptors in our brains. Our
Yeah.
brains really need that
Right.
estrogen.
Hmm.
Um, you know, um, I think about when I had PMS and how that's the part of the cycle where there's very little estrogen, and I felt a little
Hmm.
crazy.
Yes,
Right.
definitely. Don't make any major life decisions in that
No,
premenstrual phase, right?
no, no. And you know what? And there's also the opportunity to reframe that too, because I think
Hmm.
that that's actually one of the most that time frame right before your cycle starts or right around when your cycle starts when you actually are the most intuitive. And
I
uh,
like that.
and what I realized was I was most miserable during that PMS time when I was really not happy in my
Hmm.
life.
Hmm.
During medical school and residency, it was really tough. I was not with like-minded people, really,
Hmm.
you know. I came at this from a much more holistic perspective, and that was not the case with most of my colleagues, and I could hide it from myself for the
Hmm.
rest of the cycle. But
Sure.
during those few days, um, it was really difficult. And I just kind of offer that reframe to your listeners to say, well, for the women who are still menstruating and really struggling with PMS or struggling with, you know, terrible menstrual cycles, is like, is there a way that you can reframe what's happening and what you're experiencing that is empowering? And, maybe it is your intuition
Hmm.
breaking through and saying, hey, things aren't quite in
Yeah,
alignment for you,
right.
right?
Please pay attention.
Pay attention.
Hmm.
And I do think that that's what the body is really trying to tell us. This idea that the mind and the will are supreme, and the body is like a vehicle, and we just gotta like,
Mhm.
get it in line. We have to beat it into submission.
Right. Yes.
When I say
The
it like that,
spirit,
it's
the
just
spirit guides. The spirit is the leader, is the general of your body, right? Yeah.
It is, but the body is also imbued in every cell of your body with that
Hmm.
life force energy,
Hmm.
right?
Hmm.
From the mitochondria up.
Right.
And and it has such innate wisdom. And if we're willing to like reframe the way that we're thinking about it, that the body is speaking to us in symptoms, and our intuition is speaking through the body in
Hmm.
symptoms, and those symptoms aren't bad and they don't need to be medicated or removed. They need to be listened to, and perhaps shift things need to shift, right?
Yeah, I love that. I love the connection back to, really beyond the physical. We really, really need to look at our perspective and, the thought processes, the patterns that we've probably developed since childhood that are still probably dominating the way we think into
Yeah,
adulthood. And I was thinking about what you said earlier about how if it's something that patients are open to, that, hormone replacement therapy is a good option. But what if that's not an option for patients, or perhaps they choose not to because of family history, right, of breast cancer
right.
or, some other type of cancer?
Mhm.
Are there a lot of options for those patients as they're transitioning into perimenopause and menopause that, they can kind of turn to things to mitigate some of those symptoms, those menopausal symptoms, all those fun things that happen in this space?
Yes. Yeah. I mean, they're definitely like, there's definitely options in terms of managing symptoms, plenty of different herbs. And I know,
Hmm.
Chinese medicine is actually uh, a great place to go for people who are having symptoms. But
Hmm.
my suggestion would be, well, let's use this opportunity in this transition to really reflect, like, are you living the life that you want? Are you living a
Hmm.
life that you love, right?
Sure.
Because when we love what we do, when we love how our life is, things fall into alignment. Like
That's right.
usually we have symptoms and we don't feel well when things aren't going well. It's
Hmm.
or at least it's some form. And I think if we're honest with ourselves, then we really start to see that. I mean, I have a lot of balls in the air and a lot of things going on in my life right now. And I, I'm starting to talk about this, and this is so important to me. And I feel so passionate about it that I don't, okay, my sleep isn't the best, but I feel like I have the energy to
Mhm.
to move forward because th this is something that I love,
Right. And if you
right?
have that passion for something, that's the driving force that keeps it all going and keeps it all live, right? And exciting. And so I love that. I mean, really just kind of turning into sort of that mindset of what's happening in my life. What can I shift that's for my highest good? And maybe what do I need to release that no longer serves me?
Mhm.
And, that's a lot of what I talk to patients about when we're kind of working more on energy medicine, in conjunction with acupuncture. So, gosh, I feel like Dr. McCann, everybody is so lucky to see you as a patient and how you bring everything together. So, is there any last words of wisdom that you would like to share with the listeners?
Yes. Um, if you feel like you're really struggling and you're either not finding the practitioners that you need, well, there are plenty around, but I would also just really encourage you to use use the use the experience that you're going through as an opportunity, and ask yourself if there's a way that you can see things a little bit differently, rather than feeling like your body is against you and you've got
Mhm.
to like change your body. Maybe it's an opportunity to change the way that you're relating to it.
Mhm.
Um, and know that there's always hope. I mean, think about the patient that I shared. She couldn't stand up. She had to
Yes.
sit down. She couldn't microwave her dinner
Wow.
standing in front of the microwave. She had to sit down to
Mhm.
wait for it to be done. And now she's running on the treadmill. Like
That's such an
there's
incredible story.
there is always hope
Hmm.
when you're willing to advocate for yourself, to tap into your own intuition and know that you have that innate ability inside of you,
Hmm.
and you have all the tools and the skills that you need to figure this out, and with a little help and guidance from your
Hmm.
healthcare practitioners.
100%. Thank you so much. I'm going to share all of your contact information. One last question before we wrap up. If a patient doesn't live locally, but really is in need of your help and guidance, do you also help patients like through virtual consults? Is that something available through your practice?
For some people, depending upon where they live, I have medical licenses in 11 other states.
Oh,
So
wonderful.
there is a good chance that you could
Okay.
potentially be a patient. Um, And so you can contact the office for that. And if I don't happen to be licensed in the state where you reside, actually, with those people, they do still have to come to California at this moment in time to become patients. And then we
Mhm.
can do telehealth after that.
Okay.
Um,
It's worth the trip, Dr. McCann.
it's worth a
It
trip.
definitely is to
And,
see you.
you get
And
to
it's
come to
beautiful Southern California, right?
exactly,
Hmm.
especially if you're in New York in the winter.
Hmm. For sure, for sure.
Um, So the other thing I'll say too is I am in the process of uh, developing some programs to offer online programs specifically
Wonderful.
about these kinds of ideas, so that they will
Okay.
be focused a little bit less on the medicine and a little bit more on the kind of reframing of how people are with themselves. So
I
I'm
love
calling
that,
it.
Dr. McCann.
Thank you. I'm calling it the Unforgetting Project. And
The
so
Unforgetting Project.
to
Okay.
look for that.
Any expected release date?
January is when I'm aiming for.
Okay, we will
Yeah.
look out for that for sure.
Yes. Thank you.
All
Thank you
right.
so much for having me.
Well, thank you for being a guest on my podcast, and I'm looking forward to continuing to work with you and our patients. Thanks so much, Dr.
Absolutely.
McCann.
Bye now.
Bye.